Good
Raghu, over to
morning.
you.
Good morning. Welcome to the first unconference of Life Sciences Healthcare Innovation Forum. And all of you know the Life Sciences Healthcare Innovation Forum is a community brand. In the past has brought in a lot many interesting events, discussions, roundtable, policy talks. Now, for the first time, we are coming out with this a unique formatted unconference way, wherein we are taking the most contentious topic of combating COVID-19 through technology. We have a very interesting follow-up of speakers and interesting topics to be discussed, completely federated through the audience poll. People have suggested close to 90 topics to be talked about, and they selected 12 major topics. And then finally, we have to bring down to 4 topics for the paucity of time. I hope all of you will have a great time. Without much ado, I would like to introduce to the opening keynote speaker. Ms. Rekha M Menon is the chairman and the senior managing director at Accenture in India. She is the current vice chairperson of NASSCOM. She is a leading industry voice on industry advanced technology-led innovation and socio-economic progress. Ms. Rekha is the vice chairman of NASSCOM and a member of National Council of CII, the National Executive Board of AmCham, and USIBC's India Advisory Council. She's also on the board of governors of her alma mater, the XLRI School of Business, and 2 not-for-profits, Pratham Books and Aksha Foundation. Rekha regularly features on lists of most powerful women in business in India and is recognized among the top 10 LGBT ally executives globally. Thank you very much, Ms. Rekha M Menon. We welcome you on to this conference. I leave it to you to go proceed with the conference.
Thank you, Raghu. Well, speakers and participants, a very warm welcome. I hope all of you are staying safe during these very trying times. And I'm very excited about this conference because if I look around, it's rather fair to say that a nation's socioeconomic progress can be measured by the health of its citizens. And over the past several decades, we've made significant progress. The Indian healthcare system has evolved. Life sciences have evolved, especially when we consider our performance on key indicators such as life expectancy, infant mortality rate, and maternal mortality rate. Or if we look at how we've managed to curb the spread of some diseases, especially like polio, almost eradicated it. Yet, at the same time, India stays a good distance away from providing equitable, quality healthcare for all. And that's a sustainable development goal that India has committed to. There are, of course, significant challenges that continue, whether it's in the healthcare value chain, whether it's gaps in healthcare infrastructure, a divergence between rural and urban availability, and an acute shortage of skilled healthcare professionals, inadequate public funding, to name just a few. And as professionals focused on this sector, I don't need to tell you this. You know all these stats. You know that we have one of the lowest density of doctors across the world. We have one of the lowest healthcare spending as a proportion of GDP. And individual households largely shoulder the burden for services when they are available. The current COVID crisis has really put the spotlight on what we've known for some time. And it's done so in a dramatic manner. So while healthcare workers are at the front line doing a heroic job, in India and across the world, the entire healthcare system is being pressure tested. And it's cracking at the seams. And not just in India, it's cracking at the seams globally. And given that scenario, the critical role of technology in bolstering the system has never been more apparent. Whether it's enabling healthcare providers to mobilize their workforce better or deliver virtual care to those who can't visit hospitals, or accelerate distribution of critical supplies, or automate manual tasks to free up critically needed staff. Those are all just examples of where technology is already being used. But there's a huge amount more that can be done. Technology continues to be applied in a very limited way. A lot more could be done to leverage emerging deep tech for improving healthcare systems and enable the prevention, detection, management, and cure of pandemics like we are in now, COVID-19. But more importantly, what we learn now could also then be used for the mid and long term, right, for healthcare. Because advanced technology, just a few examples, could easily improve health awareness and education efforts. We have very low healthcare literacy in this country. Technology could be used to provide more power to the edge by equipping local healthcare centers, whether it's with smart low-cost devices or creating platforms that facilitate remote consultations or local decision support, or even monitoring health-related wearables. Third, it could democratize diagnostics with affordable tools. Fourth, it could enable policy development and resource reallocation, with a combination of first generation and advanced technologies, computing bringing together intelligent data and systems. And fifth, it could engineer the ecosystems to tap into the collective capabilities of the government, technology companies, not-for-profits, and startups. Technologies such as APIs, microservice architecture, blockchain could easily help build and run those ecosystems. And as we India find solutions for ourselves, we could also take the lead here for the world. We have absolutely the best technical talent in the world. We have the second largest healthcare consumer base. And now we have a perfect storm and a trigger, which is COVID-19, that we can act on. So as a tech ecosystem, I see us having a big responsibility. We have to partner closely with the health community. We need to partner with research and academia. We need to partner with government, and more entrepreneurs need to jump in, but we need more funding and investment. We need policy support. So there's a long list of things that we could do and need to do. Speaking on behalf of NASSCOM, NASSCOM is committed to bringing the ecosystem together and to help enable it for this country. And this UnConference is a great example. And thanks to Atul Batra and all the entire team that worked to make this happen. The community driven, with a bunch of sessions submitted and voted by the community. And this is the power that can really unleash innovation and change. So you are all the innovators. Let's get to work, and all the very best. With that, back to you, Raghu. Raghu, can you hear me?
Thank you very much, Ms. Rekha. And it's a wonderful insights into, and also sets the right context for this session.